Hi, hello, welcome. Welcome back to another Onkruid video. Welcome back to episode 2 in this series of exploring, deep diving the gift of therapy by Yalom. Tip number 2, don't diagnose unless if it's for health insurance purposes. Don't try to aim for or achieve scientific, detailed certainty in a field like ours, like psychotherapy, like psychology, where that is almost impossible. Don't get pressured into immediately coming up with the right, accurate, correct diagnosis by health insurance companies. Don't let them pressure you into moving too fast in that front. Don't let them make you think that you need to have a diagnosis ready. Start a short-term treatment right away that fits that diagnosis perfectly to have you send the client on his way as soon as possible. It can be of crucial importance in some diseases, in some illnesses, something like schizophrenia, something like bipolar disorder, something like neurotoxic effects on the brain, something like withdrawal from certain things like alcohol or something, because they have often a biological basis that needs to be treated immediately. But in other cases, a diagnosis can reduce a client. It can really vastly reduce a client to just that one label. And it stands in the way of the deeper connection and the more elaborate getting to know process that is very crucial in therapy and a good therapeutic relationship. A diagnosis can become a self-fulfilling prophecy. Once a person gets a diagnosis like borderline personality disorder, the smallest instability in relationships will immediately be attributed to, yeah, that's borderline personality disorder. It increases the risk of something like confirmation bias, for example, where everything you observe in the client is immediately like, oh yeah, that fits with the label. Of course that happens. We understand that completely. Often after a whole lot of sessions, or even after a couple of sessions, you realize that it becomes a lot more difficult to stamp a diagnosis on a certain patient, to take your DSM, pick the right label out of there and just stick it on his forehead. It's not that easy after you get to know the depths of a person a bit more, after you realize more about what their whole life is about. So don't just go swinging around with those diagnoses after an intake. My own thoughts on this advice, it's a bit black and white, of course. I mean, a diagnosis can really help understand a patient quickly. It can quickly help categorize the complaints they are suffering in a quick manner. Somebody that comes into the session with a depressive disorder or depressive symptoms versus somebody that comes into the therapy room with anxiety symptoms or an anxiety disorder, that requires a different kind of approach, and it's quite helpful to immediately know what direction you are gonna have to go in. But what I do think is correct is that they just should not be used as like the only source of information about that client. You shouldn't hear a diagnosis and immediately think you understand the ins and outs completely of why they act a certain way, feel a certain way, think a certain way, or how their problems arise, even though we have a lot of information of how something like a personality disorder or something like a traumatic disorder or something like a mood disorder can arise. Don't immediately think that because you know the label, you know the full story. I think that's the most important part of this advice. I know for myself personally, in my experience as a therapist, that, for example, the label autism spectrum disorder really is a dangerous one for me, especially in males. When male clients tell me like, yeah, I have been diagnosed with autism spectrum disorder earlier in my life, and I hear anything related to like socially awkward situations or miscommunications or things like that, or cringe things that they encountered in their life in interactions with others, I immediately have this light bulb in my head lighting up of like, yeah, of course, that's autism. And I fail to sometimes dig deeper into, but wait, what happened here? Is autism really the cause of this, or was it just a weird context, or did the other person play a role in it, or is there something we can learn from this and maybe get a little insight into what we can do in the future in order to help prevent these socially awkward situations? I need to focus more on that, to not immediately brush something off as like, oh yeah, that's part of the diagnosis, I know about that. That's not enough. Okay, it might be part of the diagnosis. Okay, you then know about that, but help your patient with it, help your client with it, by all means. Don't get pressured into immediately setting and into thinking in terms of diagnosis. See them as people, as holistic persons with both ups and downs. Maybe a diagnosis, but maybe just some symptoms, maybe even no symptoms at all, although that's a little bit rare probably. See you in the next one. Bye bye.